see.
Hello, everyone. Thank you for joining another installment of Black Docs Talk, hosted by Young Black Physicians. We are a team of physicians working together to educate, enlighten, and elevate our community to conquer health inequities. We're not receiving any gifts or payments for pharmaceutical companies, biotech companies, or health institutions or any other public or private institution for today's event. All of the information shared here will solely reflect the views of the panelists, and this will include the panelists' research of nationally available information, as well as the panelists' own personal experiences. The views expressed in this video are not representative of our associate institutions. This is not to be taken as a strict medical advice. All content, including text, graphics, images, and information contained on or available through this platform is for general information purposes only. As always, please talk to your doctor or qualified healthcare provider for more information. And with that, allow me to introduce myself. My name is Nicholas Fletcher. I am a resident physician in psychiatry working in the Detroit area. I hail from South Jersey, went undergrad at Howard University, HU for life, and did my MD work at Michigan State University, College of Human Medicine. And with that, I would like to turn it over to our first panelist.
Hi, my name is Dr. Elaine Ainsley. I'm a family medicine resident physician in the Metro Detroit area. I'm originally from Kingston, Jamaica, although you probably can't hear it in my accent right now, but it'll come in. But I grew up in Toronto, Canada. Undergraduate, I was at University of South Florida, and for medical school, I went to St. Lucia Atlantic University School of Medicine, and here I am.
Very nice, thank you.
Hi, I am Dr. Elizabeth Johnson. I am a general outpatient pediatric attending in the greater Metro Detroit area. I'm originally from Virginia Beach, Virginia, went to the University of Virginia, and then I went to Philadelphia College of Osteopathic Medicine in Philly. So yeah.
Philadelphia.
Not Philadelphia.
What you know about that Philadelphia? The Philadelphia, what?
It's Philly. Okay.
Philly.
Right. Okay. I'm gonna let you get away with that. But go ahead. My bad.
I'll go next. My name is Dr. Chinamelu Donald Okoye. I am an internal medicine and pediatric physician attending. I am working in New York. I was born and raised in New York. I went to City College of New York for my undergraduate studies, and I went to SUNY Downstate for my medical school. Welcome.
Welcome.
Welcome, everybody. My name is Janelle Lee Allen, and I am a gastroenterology fellow here in Metro Detroit. And like our last Dr. Okoye, I also was born and raised in New York, Harlem world, baby. And and essentially, I went to University of Pittsburgh for my undergrad. I have a bachelor's in neuroscience. And then after that, took a little detour, got a master's in urban planning, and then went back to the pursuit of medicine at the Wayne State University. And that's where I did medical school at and internal medicine at The Ohio State in Columbus, Ohio, and back again here in Metro Detroit, my second hometown.
Hi, my name is Dr. Amadi. I'm an internal medicine resident here in the Detroit area. I'm originally from Washington, D.C. area, born and raised. My parents are Nigerian, so it's Nigerian blood running through these veins.
Hey. Naija don't carry laugh.
Undergraduate, definitely University of Maryland. So old terrapins, ACC for life.
Didn't know that.
Huh?
All right, Terp.
Medical school, went to Avalon University in the Caribbean, and now I'm here in Detroit for a couple of years. So love to make some new friends.
All right. So in other words, he's single and ready to mingle. With that being said, I just want to thank everybody. Thank you guys for joining this discussion. I think it's going to be a lively one. I think you're gonna hear some great things come from some personal experiences and professional experiences as well. So with that said, the reason you guys are here is because we're talking about mental health, and we're talking about what it is. We're talking about the myths. We're talking about the facts. And then we're gonna try to dabble in some a little bit of information about our own kind of self-care. So I'd like to throw out the first question. When you guys hear mental health, what's the first thing that comes to mind?
I mean, personally, I think when I think about mental health, I think about total well-being. It's the idea of mind, body, and spirit, and that we have to be able to not forget. I feel like it's important. Sometimes we forget about taking care of our mental health, taking care of when we feeling like, we're really not ourselves, or when we're feeling like anxious, or lots of other things, just general things that everybody goes through the human experience. So that's what I think about when I hear mental health, human experience.
Okay, so we got like this whole experience type to it. You wanted to say something, Dr. Elizabeth?
I think of your emotional, psychological, and social well-being when I think of mental health. So I agree with Dr. Janelle. It is your whole being and making sure that you're centered and balanced.
So we got kind of the holistic approach. We got to kind of bring in all the different things of emotions. But how does that differ from mental illness?
Good question. Dr. Okoye, I know sometimes you when we talked about this before in the past, you've given a pretty good summary of that illness.
Sure. My idea of mental health, I think, is really just the focus of an assessment of self, and that assessment of self in relation to the world, the person. When I think about there being basically an impairment in this person's sense of self and their sense of their relationship to the world around them. And so there are many ways in which we categorize these types of impairments and different how they manifest, but down to that root element for me.
All right, but you said before illness, like you were specifically talking about how it's it gets to the point where we aren't functioning anymore. That's where I was going to that, like that definition.
Right.
Yeah.
No, absolutely. You hit it. That impairment leads to a point where you are not able to carry out your regular functions, and so someone can have an issue with how they perceive themselves or perceive others or interact with others around them, but they still carry around and able to do their regular things. But the illness, yes, is when you are no longer able to carry out your regular tasks.
Okay.
Thank you for remembering. Dr. Allen.
She got you. So it's not just about, it's not simply being sad or being anything. It's like when that sadness boils over into something that is, much more detrimental to your lifestyle and your quality of life, sounds like. And so I like to kind of, take that and add a little bit more in that, when we're thinking about the illness and what could be triggers or what could be, the impacts of mental health, we start thinking about, certain things about biology, whether there's a genetic component. We could say that perhaps, if someone's taking medications or even hormones, so there's a chemical aspect that can be contributory to mental health challenges, as well as life-altering events. We're talking about, adverse childhood experiences such as ACEs, which we call ACEs. Then we could talk about death, job loss, finances, pregnancy, home, all these things, including environmental, such as abusive conditions or violence. All these things are a part of that. And these are the things that we already know, right? Like we know that there are all these different components to mental health and the challenges that come with that. So as a community, if we already know these things, why aren't we getting help for it? Like what's stopping us from going to treatment or going to therapy? Like, why don't we think that therapy not work?
I think that a common theme, especially in Black and Brown communities is that somehow seeking help is a sign of weakness, or making sure that you take care of your mental health is a sign of weakness. And something that Dr. Amel and Dr. Janelle hinted on was that you should look at your mental health the same way you look at your overall physical health, right? If you had a physical illness, you would seek help for it. Why, if I have a cold or runny nose or cough, I'm going to go see someone about it and be like, hey, how can I take care of this? How can I treat it? Or if I had pneumonia, I'm going to seek care for it. Or if I'm an asthmatic, you seek care for it. Why is it that I can't also seek care for when my brain or how I'm seeing the world is off? There's nothing wrong with it. It's not a sign of weakness. So it's just as important to take care of your brain as it is any other part of your physical health or physical well-being. But I really think that most people think that it's a sign of weakness, or, well, I don't want anybody knowing my business. Like, what could they really help me with?
And I also, sorry, I just wanted to also piggyback off of that, because I feel like it is it's a spectrum. And I think that's what we're trying to present, that mental health is something that we all have, absolutely all of us. We all get at times anxious. We all at times get worried. We all at times get sad, have depressed feelings. But, then you get to the other end of the spectrum where things are out of control and you are not able to function on a day-to-day basis. And I think the interesting thing about that is that for that whole spectrum, counseling and therapy can help both, right? And I think that's the beauty of it. Sometimes you might feel like, oh, well, I don't have illness because I'm functioning day to day. Things are kind of hectic and they're kind of crazy, but I don't need I don't need counseling. I don't need a therapist. Right. I'm not like those folks. But the truth is, I think therapy can work for all of the spectrum. And I think that, there are so many different aspects as to why therapy can work. And I think Dr. Elaine always kind of has a really good discussion of how she's had her patients and her friends and family say why therapy doesn't work for them, and then some of her responses that she gives them.
Yes, so thank you, Dr. Janelle. I've definitely had patients come to me and say, well, I don't really need to seek therapy. It doesn't work. And it's usually based upon either their personal experience, family members' experience, somebody close to them's experience, some type of perception of media is not helpful. A lot of movies, a lot of TV shows can sometimes depict mental health in such a taboo type of way. I'm grateful for more like up-to-date shows like Insecure that had an individual who had bipolar, and that would, based upon stressful situations, would kind of disappear or run away. And then you kind of could see his progress. Very good show. Just a little plug if you haven't seen Insecure.
And the ending was fire.
Because it's done.
We're not saying no spoilers, no spoilers. But big up to Issa Rae. Big up to also, I want to say big up to real quick, Will Smith, for being able to put his whole experience and walk through his mental health and his mental health journey. And then also back to Insecure, because not only was it, Nathan, who you kind of see his challenges, but it was also the fact that Molly, who again, very functioning individual, did not have bipolar, didn't have a diagnosis, but she, presented how she walked through her own life experiences, her own life, patterns, and how she wanted to overcome them, how she wanted to take control of her own destiny, because she was seeing patterns that she didn't like, but didn't know how to fix either. So big ups to the show on that point. Back to Dr. Elaine.
And just to reiterate, we are not supported or endorsed by any
we are not.
tech industry.
We're just black people who love you.
Celebrities. We're not endorsed by
black people supporting black people.
Yeah.
I root for
That's right.
So for those of you that don't know, Insecure is a well-done show on HBO. If you haven't seen it, you should go check it out.
Definitely,
now, what I like to do, kind of reel us back in, because
reel
I think we got a lot of things to talk about. But So the thing that you guys just named out, you just about these celebrities and all these different people and shows, but does that mean that therapy is just for wealthy people or white people? Like, like uh, can we go to therapy? If we can go to therapy, then why is this portrayal of just like, the other, you know, and why is it that, we don't go to therapy, Black people don't go to therapy? Because we talk about, is it because, it doesn't work? But then some people might think, oh, you're trying to put my business on the street. Like, where does that come from?
So Dr. O'Neil, I think,
Go ahead.
no, I was going to say, Dr. O'Neil, he mentioned about maybe some representation and sometimes not seeing enough of us. You're on mute, by the way.
You're mute. You're mute. We gotta hear that. Gotta hear that accent. Gotta bring that accent out.
Sorry about that. So as I said earlier, I think there's definitely a misinterpretation of Black and brown people when it comes to medicine, especially when it comes to psychiatric issues, especially like in men in general. Sometimes it's hard for us to find places where we can actually identify, okay, what's going wrong. There's a stigma where Black men feel like they can't get depressed or can't feel sadness, feel certain things, when of course that's not true. Being able to find someone that you can trust that looks like you definitely helps when it comes to treatment, not just for physical disorders, but also mental as well. So it's just finding those spaces and just finding resources where we can get to those places and help us get better.
Love it.
And with that, it sounds like you're speaking to how important that relationship is between your, therapist, psychiatrist, or whoever your mental health professional is, how important that relationship is. But how is that any different than just having a paid friend who will listen to you?
The difference between a friend is a friend might be able to might be on your side, but think about therapy is you have a trained professional able to use their experience to help figure out exactly what you're thinking and process things in a particular way. What friends is typically you have personal bonds that pretty much, not say they're skewed, but sometimes it's biased to help make you feel good. Therapy is about identifying problems and trying to figure out the best ways to tackle them, especially things that are very difficult. So if you're dealing with sadness, for sadness of a loved one, what makes you triggers those particular feelings, and how can you best not just overcome them, but identify them moving forward? So it's like, when I get to anniversaries, it makes me feel sad. Maybe I realize, what, I see a particular holiday coming up, I take time out to think versus says, what, I'm gonna be avoidable these things or allow this precipitate to other problems, not just mental, but physical.
I love what you said right there. I mean, because I think the idea of trained professionals they understand the patterns from the very beginning. That's why they train for years, to understand the patterns of human behavior, and understand how do we break those cycles, because the mind, just like anything else, is a muscle and it can be trained on how to do different things. Sometimes it's about, people, if you've ever heard that they'll put a stone in their hand, and that kind of helps their mind to trigger that, okay, either I'm at peace, I'm here, and to settle their mind. There's other things that people, so that's a tactile response, but there's other things that people can do as a mantra, maybe, or something, a self-affirmation that you say each morning, particularly on days when you're feeling kind of out of whack, or that you say in the midst of things. So there's so many different tools, tricks, and tips that a trained professional can provide you that your friend may not be able to provide you with, or your family member. And not because there's anything wrong with them, it's just because they're not a trained professional. And I think the only thing I want to add to that just really quick is the idea of, remember also that when we're dealing with emotional things, sometimes you don't know what state your friend or family member may be in, right? And so you may be bringing your burdens to them and asking for things that they really cannot do for you. And that might leave them feeling a little overwhelmed, So just remember, a neutral party, they are there for you, literally, and to help you unpack that.
And I'll add the good points that you guys have brought up. You have trained professionals, and they are meant to absorb all the responsibility, the concerns that you guys or the people are bringing to them. They're there for that reason. Your friends, they can, you know, in some cases you have really great friends that can absorb some of the concerns that you have, the stressors, you know, they can help be your receptacle for your venting, but not all friends are created equal. You have some that can, yes, address some of the issues and help you to see through your problems, but that's not always the case. And the way in which they do that may not always serve serve you best. You have friends that may, you know, criticize you, demean you in some ways, and that might actually be more of a detriment. You have some friends that will encourage you actually even to continue down a path that's not actually beneficial to you. So, you know, while they're there, they can be great. Not everyone has that type of resource and support. And not everyone should expect that, you know, the friend should do all those things for them. You have these individuals who are out here, these professionals who they do this on a regular, and it's important that we destigmatize that relationship that can be had between the world, the people who are moving out of here, and people who can help them to get a better understanding of their self.
Yep. I like that. Well said. That being said, I wanted Dr. Elizabeth. What's that? Dr. Elizabeth, could you
add, just for cost wise, you may not have to pay a friend, but also know that for therapy, a lot of insurance is absolutely covered. So that's definitely been something that's changed in the last, I guess, about 10, 15 years. So sorry.
Dr. Also, if you go to some in some areas in terms of resources, you can find places that are nonprofits that will, you know, offer services. There's some therapists that you can pay on a sliding scale depending on what you can afford. And then also, you know, signing up for actually just getting health insurance. So if you're like, oh, I can afford it, getting Medicaid, okay? There's nothing wrong with signing up for what you need and getting the help that you need. That's important. So, but go ahead, Dr. Nicholas.
And just to piggyback on what Dr. Elizabeth said, you know, if you do have Medicare or Medicaid, you know, calling your local Medicare, Medicaid, they can help you find those services. You know, if you have it, that's their job, is to, you know, answer that phone and help you connect with the services that you need. But okay, let's say I do that. I call Medicare, Medicaid, call my insurance, they say, okay, we got somebody for you. But Dr. Elizabeth, they're just gonna dredge up my past. That's all they really want to know about. They just want to talk about how bad I was or what I did or didn't do.
Okay, well, I'm, you know, the resident child here among everybody. I'm the size of a 6th grader. So, but anyway, it's only right I work with kids. So I brought up to the group earlier, you know, there is a fantastic movie. I'm sure many of you have seen it or heard of it, but if you have not, that's a shame. It's called The Lion King. And there was a great character, Simba. There's no spoilers in this, but Simba was running away from his past, okay, and thinking that if he just buried his past and lived the life of Hakuna Matata, that it somehow wasn't going to affect what was going on in his present day or his future. And here comes Rafiki, and to remind him that you cannot run away from your past. Even though it hurts, you still need to face your past. So that is exactly what therapists and counselors help us to deal with and navigate of, why do you do what you do?
Yes.
Why do you approach the things in life the way you do? What are your triggers? Because you can go through life and not even realize, well, why did what so-and-so said to me make me so upset? Why did I react the way I did? And you not know it until somebody helps you dig through your past. So there's nothing wrong with finding yourself a Rafiki.
Amen. And I just want to add, I feel like one of the most popular artists, I think, said this best. And that is in the words of J. Cole. Like, we don't get taught how to deal with pain. You know, pain is something that is, again, human experience. no matter how long we live, we will have pain, not just physical pain, but emotional pain. And we don't know how to deal with it. So the question is, we need to teach ourselves. We are going to have to take our own destiny into our hands, like Molly on Insecure, and be able to say, I am in pain. I keep, having these same kind of things surface, and I need to know, how do I solve this problem? And I mean, just as the spiritual person that I am, I also believe that God has given us all the tools that we need in order to be able to kind of help make ourselves aware, and then also be able to do self-healing. We are the captains of our own ships. And in order, God will help those who help themselves. So helping your mental health is all a part of that. Seeking a therapist is a critical part of being able to tap into that mental health.
All right. All right. I believe you.
Thank you.
But does that,
Dr.
so does that mean, okay, fine, I go see a therapist, I tell him everything that's wrong with me, he's gonna, give me some pills, or he's gonna, give me some counseling, and then I should be good? Like, I'm not trying to, I don't have all day. So.
Oh, you asking for a one and done?
I mean,
is that
can I, I mean, just, no. I don't have time.
You can't, there's no such thing as mental liposuction. You just can't do that. We can't do
that's the one right there.
I know, right?
BBLs. We can't do BBLs on your brain. Like, that's not what's going to happen, right?
And truth be told, that ain't even a one and done. Okay.
Right. So it doesn't. It's not a quick fix. So I, as a pediatrician, I tell parents that all the time, right? So we talked about earlier how there's mental health and there's mental illness. That can mean a lot of different things. So I'll have parents who come in and they'll be like, I think they have ADHD. And I'll be like, no, actually your child's depressed, right? Depression can look like a lot of different things to people. But they're just like, well, can't you just give them a medicine? No. That's not just it's not a quick fix. It's not, I just press a button and now we're all unicorns, rainbows, and Skittles. That's what's going to happen. And I love all of those things. But you have to put in some work, and that's okay. So I tell people all the time, you can go through periods in your life when you're like, I'm good, I'm all set, I'm cruising, I'm taking the tools that my counselor or therapist has given me, and I'm good for right now. But when you reach some lows in your life, hey, I need, like Dr. Janelle mentioned earlier, it's a feeling of, being kind of out of control. I need someone to help guide me back. So that's why it's a constant like flow, ups and downs. And even if you are feeling good, there's nothing wrong with talking to a counselor about everyday things. So this is not just a quick fix. If it was, we would not have as many issues in this world.
Amen to that. I mean, and I think that's just so perfectly said, because I think, we live in this world right now. We know that from the youngest of us to the eldest of us can have mental health challenges and also can have mental illness. I mean, we're here in Michigan. One of the biggest things we were just on the national news for was what happened at a high school in Oxford, Michigan. I mean, this young man, I feel bad for all of our children, I mean, this is a tragic event, but one of the things that has happened time and time again, particularly when it comes time to school shootings, is that there's been someone who has reached out and said, like, I'm not doing well. And I feel like one of the reports that I remember saying as a teacher, specifically that day, had saw that on his screen, he wrote, the thoughts keep coming. They won't stop. I need help. Like, he literally wrote that to someone. And thankfully the teacher saw, like, hey, like, you need to, let me take you to the office right now. But the truth is, there also has to be a whole system, right? And I'm bringing this up to say mental health and mental illness is, those two things are different. And specifically when we talk about mental illness, if you see someone who is spiraling, they need your support. And that means that they can't do it for themselves, particularly our young people. Please step in and do it for them. Make sure that they don't have anything that they can harm themselves with or harm other people with. Make sure that if you feel like you're not getting the support that you need at the child's school, or don't brush it underneath the rug. Don't just think that, oh, okay, they're just going through a hard time, but they're going to be okay. Because essentially, even in that case, the parents actually bought the young man a gun. That gun was actually bought for him. And I'm sorry to take us on this kind of serious turn, but I feel like this is what kind of is in my heart. And I just want to make sure that our young people and our adults, because it's not just young people committing mass shootings, you know what I mean? There are adults who are doing the same thing. And a lot of times, time and time again, the threat is mental health, and there's a lack of systemic mental health illness. So in our community, we know how to save ourselves. And if we need to be the sounding board, YBP is here for that. And also, you guys who are viewing this video now are people who, you know, can reach many different places. So taking the time and the action to, when we see something, to say something, and to be able to really try to tap into the support systems that we have and bring people help as much as we can, please do it. Maybe, I mean, Nicholas is a resident psychiatrist, and he also can maybe just, if you can give them the few quick steps of what to do to be able to have people get inpatient help, even just real quick right now. I feel like this is, it just definitely needs to be said.
So, you know, I will say, you know, piggybacking off what you say, if you see something, say something. But when it comes to getting people mental health, anyone that you know that it may be willing to, or going down the path of either harming themselves or harming anyone around them, that are talking about, you know, things that are come in contact with suicide, those are the people that you want to call 911. Those are the people that we want in the hospitals. Those are the people that we want, because we don't want to wonder, well, what if? Because the next day, if someone takes their life, if someone does something to harm themselves, they're no longer thinking straight. They're no longer thinking in a well-balanced way that you know, a normal person will be able to think through those challenges. So when you see somebody, or you know of someone who's talking about, you know, harming themselves, harming others, it's time to get, you know, a parent involved. It's time to get authorities involved. It's time to get that person the help they need. And usually that starts with coming to the hospital or coming to a mental health institution.
Absolutely.
Also, not dismissing people's feelings. Don't be dismissive.
Right.
Yeah, and I think just to kind of push that emphasis, this is more of the reason why we all need to be aware of these type of resources. Why we need to understand what the mental health professionals really offer, because not only is it something that you do help yourself with, but you can offer to others. It's just being able to know that there is a safe space where someone can air out their frustrations, they can have their perspectives assessed, they can really talk through a lot of the issues that they're dealing with, and potentially make changes in their lives that can benefit themselves as well as people around them. And that includes preventing harm to people around them. Yeah. Knowing that is available, and there's an issue with access that, I mean, we haven't even touched on in some places, but I mean, there are opportunities in terms of that are out there that we just need to get people aware of. You want to make sure that you know how to get connected through your insurance, through programs that are out there, through telephone services. All right, knowing that, then you are much more prepared for yourself as well as for the next person.
Yeah.
And I just want to also add that when we talk about people needing help, that also includes if you have somebody and you know, let's say a family member suffering with mental illness, again, inability to function on a day-to-day basis, you know that they aren't able to take care of themselves, meaning you go to their home, maybe they're not clean, you know, maybe they haven't, you know, washed, maybe they haven't, doesn't look like they've eaten in days, doesn't look like they've slept in days. Those are other things where you can call 911 to do a wellness check. You can also, you know, if you can convince them, you can also ask them, be safe, because sometimes, you know, in mental illness, there can be a challenge of people not wanting to, you know, do what you say. But the idea of, if they can, you know, going to the emergency room and taking them and letting them know, like, hey, I'm concerned, this is what's going on with them. Because again, that's a place where they can get help and inpatient help in many cases.
I just want to say, as a pediatrician, I agree with everything that you guys are saying, but sometimes, like, so our system is very overwhelmed, And very often, I know that you guys like working in the hospital have seen this. I know at least Dr. Amel and I, working at one of the children's hospitals, we've seen kids come into the emergency room and they could be down there for days. And by days, I mean sometimes weeks. But if somebody really needs immediate help, you should go to the emergency room. But what if it's just like, I need some help, but I'm not that bad. I just want to drop some resources. So like I said, there's local universities and nonprofits. They have many qualified, many hospitals have, programs like where you can see psychology students, those who are in their master's or doctorate programs, and you can like pay on a sliding scale. Some of those services might count, or they might cost like $5 a session, things like that. You have BetterHelp, which is an organization that offers affordable access to therapists with no insurance necessary. You have things like Talkspace. And then you have another resource is National Alliance on Mental Illness. So I just wanted to put that out there because not everybody is in need of like acute care, right? Like where it's like, I am suicidal, or I'm going to hurt myself, but I do need help. Those are resources that you can go to get help.
And I think also there's also some like pop culture, things that are out there that I think, can be tapped into as well. Things like, I know Taraji P. Henson, she started a whole thing on psychology and counseling. I know that Charlemagne the God, I often talks about mental health and how, he utilized counseling. And also he talks about the idea of finding a match, making sure that you're finding a counselor who agrees with you, or who not agrees, but rather who you are in alignment with, and you guys are able to communicate well together, and to not stop until you find that. It's not a one and done on that in that regard as well. We'll also put some things in resources. You can also comment on this video or email us at youngblackphysicians.com if you're feeling, or youngblackphysicians@gmail.com. If you feel like, there's some other things that resources that you are having a hard time with, and we can respond to the emails.
And so I really like where we're going, and I think this would be a great place to talk about how we change the narrative, right? Yeah. So, we have an opportunity here to say, hey, this is where we know we've come from. When we talk about Black people, we talk about the community, we're talking about, essentially that there is this underlying collective trauma that we've, kind of in our attempt to kind of push through, just, carry on as if there is nothing to that. And I wonder if anyone can kind of speak to how they perceive the collective trauma that is being Black in America, and how that affects our mental health.
You mean like your Black Wall Street?
Like my Black Wall Street shirt.
Yeah,
there was a Black Wall Street. We don't even know anything about that, but we still carry that trauma of what happened to those individuals. And so I wonder, when we're talking about, whether slavery, Jim Crow, and the civil rights era, all those things, like, what do you think that does to us?
I mean, one, it desensitizes us to pain, constant setbacks, pushbacks. You sort of just internalize that and assume that if you're not able to move forward, that's just the way life is, that's the way things are. And that's a concerning outlook that's been sort of embraced in a lot of ways. This has led to pushback against many societies. This is why a lot of Black and brown communities have issues with the government, have issues with the healthcare community. They just look that they are just another entity that's looking to push them to the side, marginalize them even further. So it's that type of history that's led to us thinking the way we do, and not really embracing the beneficial programs that are out there, the people who are really out here trying to make differences. We just group everybody together as people who are really trying to do something to us. And unfortunately it's protective behavior. It's something that we do to keep ourselves from being hurt again. But what we are trying to do in this space is really try to get people to open up and say, like, there's some assessment, self-assessment that could be done, and that we got to find that there are people we can trust and resources that we can engage in to be better, and to get better services for ourselves.
When I think of like the collective trauma, I remember an artist. I'm Jamaican, so it's going to be a Jamaican artist, Bob Marley. One of the songs he has called Redemption Song, one of the things he says is emancipate yourself from mental slavery. I feel like the collective trauma has a tendency to have your mind kind of thinking kind of one track when it comes to your outlook, when it comes to your perception on certain things, just based upon the repetitive trauma of your life experiences. So I feel like the biggest thing is being kind of having an acknowledgement of that. I feel like that's the first and biggest step, is acknowledging that, yes, this trauma has happened, it has occurred. And then at the same token, it's like, what am I going to do about it? There's definitely resources out there. We've talked about it throughout this entire talk of websites or universities you could use, or different types of programs, nonprofits that you can go to. And sometimes it just starts with a conversation with a friend, that they may have a resource that you don't know about, or a family member may have a resource that you may not know about. Everybody's going through something. And I feel like if you kind of lean on somebody that you can of course trust, they could actually help to provide you with those resources if it's something that you don't necessarily have immediately in your hands.
I think that we deal with living in a society where systemic racism is very real. We deal with racial trauma on a day-to-day basis. And that could, so it's not just, and we also are living in a day and age that we are oversaturated with social media and videos. So, I mean, we've known about racial injustices forever, but now we also see killings every day, or just different things all the time, on top of dealing with the microaggressions that you might deal with a day-to-day basis. It's a lot. It leads to chronic stress. It leads to anxiety. It leads to depression. It can lead to low self-esteem. It can lead to us self-medicating or self-treating in other ways, right? With substance abuse, things like that, or just feeling an connect. It affects every aspect of our life. We don't get a day off. That's how it feels to be Black in America, I feel like, and dealing with racial trauma. We don't get a day off. And so it's hard. And so I think more, especially as a marginalized group of people, we should definitely be seeking counseling and therapy. We also need, like we said earlier, just more Black counselors and therapists. So it's very, very important. That's my little piece.
I mean, we are resilient. Yeah, that was very well said. And we are resilient. We are resilient people. I mean, think about it. To get here, we had to be, right?
Amen. Yeah, that's what I define as African Americans: excellence against all odds. I mean, to have gone through what we, African Americans and Africans, I mean Black people, okay, in America, excellence against all odds. I mean, we've gone through so much, but like you said, we are here. And not just here, but in many respects, we have lots of work to be done, lots of changes to make, and that's in the larger society as well as amongst ourselves. But we certainly are excellence against all odds. We define.
Yeah, Black is beautiful. Black is beautiful.
Amen.
Black is beautiful.
Right?
I would say, and I would say that Black is beautiful, and I think that what we have to be careful of is not to assume that, just because someone's not talking about the mental illness, that they're fine. Just because someone just like, Black men in particular, we'll just get it done. We'll just pick up and we'll go and we'll do what needs to be done. And we'll suffer in silence until all of a sudden we drop dead at 55. You just knew your dad or somebody, he just worked. He got up, he just went to work, and then all of a sudden, the day after he retired, he's dead. And I apologize if that triggers anybody. I should have said that more more carefully, but it's what happens. It's an unfortunate. And then our Black sisters, our Black women, we got this Black girl magic thing going around, but it's to say that you guys have magic, like you can do all things now with magic. Is that really what we're saying to y'all?
Yes.
I mean, it's true. It's
we got
absolutely
Black
true.
girl magic moments.
Yeah, I mean, it's not the
Yeah,
life. The
like
life
me.
itself is magic. The life you guys live, you know, living in intersection for Black, female, in society that doesn't give you the proper due. But I mean, it's true. But then it automatically assumes that you're a person to be burdened. You know, are supposed to be allowed to handle all these things, everybody's responsibilities, and on top of your own, because you can handle it. I mean, that's a horrible perspective that we should be having towards an individual. One, yes, it raises the expectation. Let's find a way to meet it. But that type of stress that comes with it is what leads to, you know, early medical problems, early mental problems. And so it's just all these types of thinking that we have. We need to really try to get that undone.
And like you said, I think it's about making sure it's grounded, right? You know, because all these things are true in many aspects, but then there's also the idea of, you know, we cannot compensate. We can't think that we're superhuman, because the truth is we are still human. We are living a human experience. And so therefore we have room to be able to put down our burdens, and we have room to be able to tap into the inner parts of ourselves, and to be able to be honest with ourselves and know, I need help on this aspect. Doesn't mean that you're any less brilliant. It doesn't mean that you're any less gifted. Doesn't mean that you're any less intelligent. But what it does mean is that you are human.
And so I think we have about 10, 12 minutes left. And, you know, I'd like to kind of finish out with a small piece of kind of each of us kind of talking about what we do for our own self-care. But before I get into that, I'd like to simply say that, you know, this conversation that we've been having, I think is really positive. And, you know, it's about removing the stigma around mental health and about mental illness. And so, you know, I think it's powerful when we share our stories and we put our faces to these stories, and we try to normalize mental health so that we are connecting ourselves, and we're connecting others who are listening to treatment options so that they don't have to suffer in silence. You know, I came across the saying that, you know, it's okay to not be okay. And I think, you know, being able to know that, feel that, embrace that, and realize that you don't have to do all things and be all things to all people. And so I wonder if you guys would be interested in just sharing a little bit of what you guys do for self-care. Like, how do you take care of yourself? We are, you know, A-type personalities. Most of us, we you know, some of us are kind of, you know, we are either carrying in the footsteps of professionals, or we may be, you know, first in our family in this professional setting. And so I wonder, how do you carry all those things with you on a day-to-day basis? How do you take care of yourself?
I do a few things. I like to take time with my closest sister friends just to catch up. I think talking to them just brings me great joy. You know, another thing I'm practicing with self-care is setting boundaries. That's very important. Practicing saying no. That's actually really hard for me. And then another thing is setting up time for like quiet time where everything is just off, unplugging. So time to like meditate, whether you are a spiritual person and you like to pray, whatever it is, to get in touch with yourself and ground yourself. And then something I did, I love music. So I created a playlist on my like Apple playlist that's called like Morning Cup. And so I look at it like a cup of coffee or a cup of tea. Anything that makes me happy, and I just will dance around. I don't care. I try to practice my Millie Rock. It's not good. I try to practice the jerk. It's not, my Millie Rock, I get so excited. I get like one side, I'll be like, whoop.
Yes, the one side. The one side.
It's like I like when I realize I'm doing it, I get so excited and then I just swoop over and it's so bad. But things like that, practicing makes me happy.
All right. So Dr. Elizabeth has her Millie Rock. What say you, Dr. Anu? What you got?
I've started journaling, so I think I've like since COVID, like I take time. I try to do every week, but I try to journal exactly what are thoughts or things accomplished I want to do. Also, I've also tried to like write letters to myself based on like certain days where I might not feel. So just to see accomplishments, I think it's kind of like chronicalizing like how your feelings are in some place where you go back and read them. Because again, sometimes therapy doesn't always have to be in front of somebody else. Sometimes if you can just take time to reflect, you know, you can actually journalize and come back and read it at your own pace. I think that's important. I do like to listen to music. Typically, if I have a stressful day, when I come home, I'm going to listen to Afrobeats for about half an hour to an hour, maybe up until the entire night.
Ooh.
Might have a glass.
Takes you there.
Might have a glass of bottle of wine or two. You know.
You need to go plug in for Rema REMA. That's the Afro pop next wave right there. Jump on.
we need to get the air. I'm gonna follow that with an air horn later.
Please, Kim and Kat.
There you go. There it is.
You're welcome.
All right. Let's give him back the floor. My bad.
But also, talking to family. I think talking to family and friends who care about you, care about them, they care about you. I think that's important. I think one of my affirmations a couple years ago was making sure people around me know exactly I care about them, and they should. And hearing them, they actually care about me, and hearing that and actually doing that kind of makes you feel like you're a person versus just a robot.
Very good. Dr. Elaine, what say you?
Yes, for me, I do a few things. Probably one of the biggest things for me is travel. I stay booked for something. So for me, it keeps me focused, and it keeps me focused in the moment because it always reminds me like it's coming. So I work really, 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 really hard so that when that time that I could take off, I'm taking it off. I'm relaxing. I'm doing, so like right now, I literally just came back from the holidays, but I'm already counting down days until I hit my next trip. So that to me is a way to kind of keep me balanced when it comes to especially like a work-life balance. So that would be a big one. Another one is I recently got back I play acoustic guitar, but I had it at my parents' house. So I finally got my guitar back. So anytime I'm kind of like maybe a little overwhelmed or kind of just want to just have a breather, I kind of will just play some music or listen to music. Definitely music is a big thing. Similar to Dr. Elizabeth, I'm not really working on my Millie Rock. I tried jerking over the holidays. It was the disrespect. These individuals were saying, I don't know how to jerk. I said, listen, this is my era. I know what I'm doing. And I wish I could record it so I could share to people to prove that I am, but so dancing and listening to music, karaoke, watching TV, watching movies. On Friday nights are usually I dedicate as like my me nights. Yeah. So I usually have like a movie night. So that's when I binge watch any TV shows I haven't gotten to see throughout the week or any movies that came out that I haven't gotten to see. I'm trying to think if there's anything else. And on occasion I paint, like acrylic painting. That also kind of helps to kind of de-stress and kind of just gets my mind kind of off. Yeah.
Okay, very good. Sounds like you have a really good balance. You know, you work hard, but then you earn your binge day at the end of the week. Yes. I like that. Dr. Amel, what say you?
No, I also like that grinding for the peace of mind. A lot of what you all have said, I actually do for myself. And, periodically I might take one over the other. Definitely music, when I do get a chance, definitely, hit that dance floor if I've got to. My go-to regularly is basketball. That's always been something that has always gotten me to center myself, always. So that's huge for me. But I definitely am one like Dr. Amadi, the sort of insular type. I like to get to myself and find space and really just kind of become one with my thoughts. I tend to be really analytical, logical type, so I try to think through my process, my interactions. And I don't know if any of you guys have those issues when you had some interaction with somebody that was not so, uplifting, some problems. Yeah, you gotta you think back, all things, what you would have said, could have said, and
Practicing the clap back. Like clap back. When I see him, this is what I'm gonna say.
On site. It's on site now. So you think through that. You think through that process. You just think, okay, how did I handle that? What was the way I approached that? I'm good. Were there things that I could have done better to maybe improve that outcome? So I do sit with myself and do that. And I will say, not just be really brief. My times, throughout the time I had many periods where I've kind of had stressors and I had to go, do these things. My what I call coping mechanisms. I mean, but there are periods when they broke, it didn't work for me. This is specifically when I was in training, my residency training. That was the time I was tried the most that I've ever been. I mean, it's really gotten to a point where I felt like I really questioned everything about my ability, my self-well-being. It really took its toll on me, and that's a stage where I actually sought counseling, and it was probably one of the best things that I did. I've been much more appreciative of myself and what I bring to the table. I am not so quick to take on other individuals' opinions of me. I just take umbrage and prove them wrong. Like I'm glad that I'm in this position that I'm in. They can say what's and such and such things about me. I just go about my way, prove them wrong, keep it moving. But I mean, just being able to relieve a lot of my tensions and vents to other people, that has really been something that's really been crucial and helpful for me. So I'm so glad that I was able to experience that.
All right, thank you. I especially connect with, those trials in residency. For me, it was medical training, medical school, and so I definitely connect with where you're coming from there. So thank you. Dr. Janelle, how do you get through your day?
I definitely have to say you back to all y'all. I think things that I feel like that we haven't said yet, at least that I know that I do, is also like structured self-care, like getting my hair done and having me time that way. And also, getting massages. That's something that's been helpful. Definitely the spiritual aspect. And like we said that music and dance for sure. Rocking out on your way to work, loud as you want to be, or on your way after work, loud as you want to be. I have some particular songs that I put on. I think also just as Emil had just beautifully pointed out, times when I'm most stressed and I know that I feel like I am just not in the place, definitely counseling, whether it be telehealth, and just doing a telehealth visit and being able to tap in. But that's definitely something that's very helpful for me. Just having somebody who's actually there for me, especially in the midst of, like we said, sometimes this whole black girl magic where you are taking on the world and you feel like, well, who's here for me? I found that in counseling. So that was really, really helpful. I think that's about it. I just, I think you guys are awesome. That's all I want to say is I'm happy. And also, just doing things like this is also part of my self-care, being able to carry out passions and being able to give back to the community. And the same way that, at least me knowing this does my heart really, really good. Knowing that when I was growing up, this little Black girl in Harlem, there were so many people who fed into me, and you don't realize it, your teachers, the people in your church, all these things, that these people who are supportive and who are loving for you. You don't realize, how many of those folks are there. But for me, as far as my life journey and my passion, is to also be able to do the same thing for somebody else. And every day, that's something that really serves me really well.
All right. Okay. I
Oh,
gotta follow up.
also,
I gotta follow that up.
Oh, wait,
I'm
Dr.
sorry.
Go ahead.
Elizabeth, go ahead.
Dr. Liz, go.
Dr. Janelle also said, like in point two, if you to let out some stuff, like, okay, yes, counseling is also great, but they have rage rooms, like local rage rooms. Amazing.
Oh,
If
there's
you
a
don't know
rage
the
room.
yes,
No,
the
tell
rage
us a little bit.
it's so good, and it's healthy because you're not hurting anybody else. You're not hurting anyone. Okay. If you really need to, like Dr. Mel was saying, like if somebody said something that really triggered you and made you upset and you couldn't get it out, right? Especially like in professional settings, you're trying to just keep it in. And especially as Black and brown people, we really don't want to look like that angry stereotype. They have rage rooms where you go, they give you a bunch of glass plates, actual glasses, frames. And let me tell you, they have everything, and they put you in a little hazmat suit, goggles. They give you everything you want to break. So I had a bat, a crowbar, a hammer, a sledgehammer. I got so much rage out to the point that I accidentally broke the table that they had the stuff on it, but it was amazing. And I'm only 5'1".
Can I just add? Let me not take away
Small but
anything.
powerful.
Yeah, I mean, don't mess with her. Nah, don't
That's
mess.
right.
But
Ain't
I
got
mean,
nothing,
just,
ain't got
take you out
nothing
at
on
the
you.
ankles. I can take you out at the ankles, but guess what? I don't, because I go to a rage room and counseling. And,
Yes. Yes.
so
It's rage rooms. I think we're gonna have to put that on the calendar. Maybe we might. That sounds good.
It's amazing. But sorry, go ahead, Dr. Nicholas.
No, Dr. Mel, you want to say something real quick?
I mean, I feel like I think that says enough. It's a form of catharsis. Just that sometimes you get so used to using that as your coping that when you don't have that room to continue stuff, you end up doing stuff to other things, you know. So you kind of want to have
slippery slope.
Balance out what you use for catharsis. And just
well, look, I just want to add, let me just say this. This is the one thing that's really beautiful about talking amongst ourselves, because honestly, I never knew about a rage room. In addition to that, you know, I feel like sometimes, like we said, the media, you know, all this other stuff, it teaches us sometimes poor coping mechanisms where, you know, that takes us down the wrong path. But when you start talking about constructive coping mechanisms, even if you don't have it, you can get a punching bag in your house. You know, I know that I at times like to put on the hard hat and be a woman renovator, and I've built many things on my own. And being able to take that hammer and have, you know, there's things that you need to fix, do that, and you're also helping your own house. So it's the idea that there are so many different positive things that you can do to let off steam. Physical activity, like Dr. Yamel said, you know, that basketball is also something that is a part of your weight journey. You know, not just about the mental. Remember, all of this mind, body, spirit. There are so many different activities that you can combine all of those things together.
So with that, I would say, you know, mental health is physical health. It's all the same. You got to have one with the other. It's a yin and a yang. And for me, that's, you know, similar to everyone else. You know, structure is really important to me. You know, having a routine, knowing where I'm going to be, knowing what's expected of me, really helps me prepare for the day that I have ahead of me. I love playing soccer. I love working out. My body tells me when I've eaten too much, when I've drank too much, when I've been sitting around too much. My body will tell me when I step on that soccer field. So that's how I keep myself honest. That's how, you know, I kind of keep a clear head just from working out and all those endorphins that come with it. But the other thing is, like everyone else has said, talking to family, talking to my wife, you know, and I've been to individual counseling, I've been to marriage counseling, and what that does is give me the tools necessary so I can go out into this world and be my best self. And so I've taken advantage of all the things that we've talked about here today, and I encourage anyone else to do the same. And so with that, you know, I'd like to first say thank you to our panelists. Thank you to the YBP and everyone else. Thank you for coming out to another installment of Black Docs Talk. And, before I go, if you're feeling overwhelmed by, thoughts or suffering emotional distress, or, if you're having a crisis or feeling like, things aren't going the way you want them to, or if you're even thinking about taking your own life, I urge you to please call 911 or your local emergency number. Call suicide hotline. That number here is in the US is an 800 number. It's 1-800-273-TALK. That's 1-800-273-8255. And just remember that you're not alone. It's not your fault, and help is available. Thank you.
Absolutely. Good night,
Thank you all.
everyone. Remember to like, subscribe, follow us on Instagram, follow us on Facebook, YouTube, put your comments in, email us at youngblackphysicians.gmail or youngblackphysicians@gmail.com. We are here for you all. That's why we're here.
Absolutely. We love you.
Good night, everyone.
Love you.
Now, press the end button.